JoAnn Stapp for Science for the Public, and I welcome you to our Contemporary Science Issues and Innovations program. Vitamin D is important for bone and muscle strength, but for years it's also been promoted as a preventive for heart disease, cancer, and numerous other conditions. Our guest, Dr. JoAnn Manson, led one of the largest and most respected studies to test the widespread belief that vitamin D supplements are a kind of cure-all. The results contradicted that belief. Dr. Manson is, among multiple titles, Chief of the Division of Preventive Medicine and the Michael and Lee Bell Professor of Women's Health at the Harvard Medical School, and also Professor of the Department of Epidemiology at the Harvard Chan School of Public Health. In this discussion, she explains what vitamin D really affects and how much we actually need, and the importance of the structure of the scientific studies in determining the effects of these supplements. Dr. Manson, thank you very much for joining us today, and a big welcome.
Wonderful to be here.
And I would like to start by asking, what is a vitamin? And then we can get into the vitamin D issue itself, if you would. Why are vitamins so important? What are they?
Vitamins are nutrients or organic compounds that are required in small quantities, also called micronutrients, and they're essential for general health, growth, and bodily functions. Now, most vitamins are obtained through the diet and are not synthesized in the body. However, one exception is vitamin D, which actually can be synthesized in the body through the skin with exposure to ultraviolet B light.
Okay, you mentioned that in your work, in the articles about this, that comes out that the sunlight is actually the best source, apparently, for vitamin D. But so anyway, now about vitamin D, there's such a, should I say hype, about what it does, and also the tendency to think that there are deficiencies in vitamin D. Can you give us some information on that, and then we'll get into the study?
Whether or not someone is deficient or insufficient in vitamin D depends on the cut point that's used by the laboratory or by the researcher or clinician in defining deficiency. Now, more recently, very high cut points have been used. Anyone who's below 30, 40 nanograms per mil is considered deficient. That is not the way most of the professional organizations and experts would define deficiency. Deficiency tends to be individual, because people have individual requirements. You can't just say one number, but it tends to be a much lower number than 20 or 30. And some groups have used about 12 or less. Now, that's a small percentage of the population that has a blood level below 12 or 16. And so if you use that cut point, you may be talking about 5–10% of the population. If you use a cut point as high as 30, as is used in many of the reports, then it's going to be over half of the population that's considered deficient or low in vitamin D. But we actually require only small to moderate amounts of vitamin D for good health, and the Institute of Medicine has set the recommended dietary allowance at 600 to 800 IUs a day, and has not recommended that supplements need to be used routinely.
Okay, thank you for that. And then one of the big problems was that this so-called lack of vitamin C or deficiency in vitamin D was associated with many diseases or conditions or health risks, heart, cancer, diabetes, a whole range of things. How did that come about?
That is based mostly on observational studies that look at the correlation between a blood level of vitamin D and the risk of having cardiovascular disease, cancer, diabetes, and other health problems. In epidemiology, we often say correlation does not prove causation.
Yes.
And there can be many confounding factors that can influence vitamin D blood levels. For instance, a poor diet quality, you may be low in fruits, vegetables, and a lot of other important components of the diet. You also be low in vitamin D. It doesn't mean it's
Right.
specifically the vitamin D. Also, people who are not physically active and don't spend time outdoors, they're not getting the sun exposure to have a higher vitamin D blood level. But we know that sedentary lifestyle, lack of physical activity is a risk factor for many chronic diseases. Also, higher body weight and adiposity are associated with lower vitamin D blood levels, because vitamin D is fat soluble and it gets sequestered and stored in fat tissue. So the blood levels are lower, and we know that obesity is also a risk factor for diabetes, cardiovascular disease,
right.
cancer. So they're confounding factors. This is why we recommend the randomized clinical trials where all the other factors balance out. And the randomized trials have not shown similar benefits.
Exactly. That is where we need to go next. I'm sure that you are aware that the general public doesn't know a lot about how these studies are structured, and therefore the different outcomes or conflicting outcomes are not easily understood. And so if you would please tell us, again, first the issue of how these studies are structured, first the observational of studies versus the controlled studies. And I want to spend time on yours in particular, but could you step us through that observational study? Because I think it's pretty common.
So observational studies are health tracking studies. They're looking at what people do and then relating those exposures and risk factors to health outcomes where there is the potential for confounding factors. A randomized clinical trial is an experimental study where you assign people at random, like a flip of a coin, to get an active intervention, such as a vitamin D pill or a placebo pill. It's double-blinded in that the participant in the randomized trial doesn't know if they're getting active or placebo pills, and the investigators don't know. And then you follow the study population forward for clinical outcomes such as heart attacks, strokes, cases of cancer, and deaths, and many other outcomes. And then you can look at the specific direct effect of the intervention, because usually all the other risk factors will balance out by the experimental design.
I see. And now your study got a lot of publicity, and it seems really beautifully constructed. Can you please tell us about that? It's the VITAL study, it's called, but that's the acronym.
The vitamin D and omega-3 trial, or VITAL, is the largest randomized trial of vitamin D in the world. And it includes about 26,000 Americans. They're all over the age of 50. It's about half men, half women. We have racial ethnic diversity. And it was done in a very cost-efficient way. But we basically assigned half to an active vitamin D. We also tested in a completely independent way the effect of omega-3 fatty acids, but that did not in any way affect the results for vitamin D. Versus placebo. And then we looked at a large number of outcomes, including heart attacks, strokes, cancer outcomes, cancer deaths, autoimmune diseases, fractures, diabetes, many health outcomes.
Right. And this took place over how many years?
5.3 years on average for the follow-up period.
Okay, and a huge number of people, and it is randomized, and then these things are checked carefully. And the surprise it really was a big surprise in the medical community, apparently. Can you tell us about that?
Well, overall, we found that there wasn't a significant benefit of vitamin D supplementation, which was a dose of 2,000 IUs a day versus placebo, for the prevention of cancer, heart attacks, strokes, and all-cause mortality. Now, we did see some benefits for cancer death and for advanced cancers, such as metastatic or fatal cancers. And we think, although more research is needed, that vitamin D may have an effect on reducing the aggressiveness of cancer. This needs more research. However, overall, we did not see benefits for first diagnosis of cancer, cardiovascular disease, or these other outcomes. We also did not see a benefit for reducing fractures, hip fractures, osteoporotic fractures, which was very surprising. Now, this doesn't mean that vitamin D isn't important. Vitamin D is essential for good health. However, it appears that we need only small to moderate amounts of vitamin D to achieve good health and to prevent many of these chronic disease outcomes. And once you get to a certain level, you don't benefit from additional supplementation. And most people in the general US population are getting enough vitamin D from a combination of diet and incidental sun exposure. But some people do benefit from a supplement, and there are high-risk groups who need more vitamin D if they have malabsorption conditions, Crohn's disease, ulcerative colitis, if they already have osteoporosis, they're taking medications for osteoporosis, or they've had a history of fracture. People who are, for example, in nursing facilities where they're getting very little sun exposure and they may not have adequate diet. Some people will benefit, but no professional organizations are recommending routine, universal supplementation with vitamin D, or even screening for vitamin D blood levels, routinely in the population, because there are only certain groups that benefit, and some clinical, what we call looking at risk factors and identifying those more likely to have low blood levels or need supplementation can be done in the clinical setting.
Right. I understand, if I recall from one of these articles, that you also mentioned that I guess in your annual physical, you might be taking a blood test for vitamin D, and you say this is not necessary. I wanted to make sure of that.
It is not necessary. Most professional organizations in the United States and really throughout the world do not recommend routine universal screening for vitamin D blood levels. That would tremendously increase healthcare costs. And also it begins this, cycle of continuously repeating blood levels and, leading to some unnecessary supplementation. So it's not recommended. But that said, there are some high-risk groups who will benefit from supplements. We did, in fact, see a benefit for autoimmune diseases like rheumatoid arthritis and psoriasis and some of those autoimmune conditions. And some people who may be at higher risk may want to discuss that with their healthcare provider. But the benefits were quite limited. And this has also been found in other randomized clinical trials. That many other randomized clinical trials have now been done, and they have not shown benefits for prevention of cancer, cardiovascular disease, or many of these other chronic health problems.
Yes, thank you very much for straightening out this kind of illusion that we all have to run out and get a whole bunch of vitamin D. And but there one more thing just on the vitamin D as a supplement also, that is quite different. The source is different from, say, sunlight or what is found in foods. Is that true? And does that make a difference? The stuff that is in supplements, is that different from and significant from natural sources?
The molecule ends up being very similar, and more
Okay.
research needs to be done about whether there are other benefits, for example, for the immune system that you get from the sun exposure as
Yeah.
opposed to just taking a dietary supplement. But we have to keep in mind that having very high exposure to ultraviolet B light or even ultraviolet A light can increase risk of skin aging and
Yes.
skin cancer,
Right.
and others. So we're not recommending being outdoors without sunscreen and, in the middle of the day and really trying to get a lot of sun exposure in order to get vitamin D blood levels up. But just incidental time outdoors, running errands, being
Yes.
physically active, that together with the diet and reading nutrition labels. The labels will now tell you the content of vitamin D, and many foods in the US are fortified
Yes.
with vitamin D. So you can get a fair amount from the diet and from incidental sun exposure. And those who have higher requirements, working with their healthcare providers, they may be started on a supplement.
Right. That's very helpful. And we have such a big thing about vitamins in this country now that's very comforting to know that you really could do quite well with a healthy lifestyle and a healthy diet. And that this idea that we have to take multivitamins or take these supplements, especially vitamin D, is not really a necessity unless your health provider indicates that it is. Dr. Manson.
We often do say that.
Yeah.
We say that dietary supplements should never be perceived as a substitute
Yes.
for healthy diet or healthy lifestyle. And actually, there's better absorption of most of these vitamins and minerals through the diet.
Yes. Dr. Manson, I think that in your study that you said there may be a connection between the vitamin D and deficiency perhaps and long COVID. Is that correct? That's something you're exploring?
We are exploring this in another completely separate randomized clinical trial of high-dose vitamin D for prevention of severe symptoms of COVID as well as development of long COVID. And we expect those results to be published by the end of June.
Aha. And so this came out of the original VITAL study that you thought, we need to pursue some of these other possibilities. Did you find anything else that you are pursuing?
We are interested in the autoimmune findings to see if a separate trial looking at vitamin D in preventing autoimmune conditions would be effective earlier in life when autoimmune conditions are more common, such as for people in their 30s and 40s. VITAL was all 50 and older.
I want quickly in our last minutes here, this got a great deal of publicity. One thing first, before we go into other areas of your research, is that do you think that your study, which got so much publicity that for its quality as well as its results, do you think that that will influence a shift to these randomized studies instead of the observational type studies?
I think it is important to do more randomized clinical trials. However, they are more expensive than observational studies, so there needs to be funding mechanisms for doing these trials. We try to do randomized trials in a very cost-efficient and pragmatic way. For example, most of the VITAL trial was done through the mail. We mail out the study pills. We have collect medical records, through getting consent through the mail, and contacting hospitals, to confirm endpoints, and doesn't require in-person visits for everyone on a regular basis. So trials can be done very cost efficiently, and I do believe there should be more trials
Yeah.
testing important hypotheses, but I also acknowledge that the costs tend to be higher than for observational studies.
On the other hand, the difference in the quality and results is really pretty significant.
Yeah.
So it just seemed to underscore the difficulty of and how problematic these observational studies were. And again, you could end up with getting people to take things they don't need to take or do things they don't need to do in terms of their health if the study is bad.
Observational studies can still be very important.
Do you think?
And they do generate the hypotheses to test in randomized trial. But there are certain risk factors like cigarette smoking where the associations are so strong
Yes.
that you can get a clear answer from an
Yes.
observational study. But for some exposures where associations are much more modest, it can be difficult due to the confounding.
Yes. Okay. We have just a few minutes left. Dr. Manson, I'd like to ask about what you do a lot of different things, but can you tell us what you're working on now that is of most interest to you?
Well, we're very much interested in the potential role of multivitamins in reducing age-related memory loss and cognitive decline. And we're seeing some exciting findings for multivitamins in 3 separate placebo-controlled trials within the overall Cosmos trial. This is a separate randomized trial. We recently published those findings and did a combined analysis of the 3 trials, and there was very strong statistical significance for slowing memory loss and cognitive decline. So I think that that's very exciting, and we are interested in the role of vitamin D in terms of long COVID and reducing severity of various infectious diseases. We're also really interested in the omega-3 fatty acids.
Where would you get the, what
EPA.
foods are those in? Yeah.
Fish
Yeah.
is a major source. I want to just highlight one point,
Yes.
which one additional point, which is that it's important to avoid mega dosing with any dietary supplement.
Yes.
And more is not necessarily better, and it can be worse.
Yes.
There are some risks and toxicities involved with very, very high doses of individual supplements. It's one of the reasons why we're leaning more toward the study of multivitamins, because it's giving smaller doses, but the amount of vitamins and minerals that are the daily intake levels, the recommended dietary allowances, very safe, and also, comprehensive, more than 20 vitamins and minerals. We did see that vitamin D at 2,000 IUs a day was safe, but once you get to doses much higher than that, they have not been well studied long term.
Yes.
For people who are worried about their vitamin D intake, we do think it's reasonable to take a modest, a small to moderate dose of supplementation, like during the winter, or people who are at older ages or are concerned about health conditions. But generally, wouldn't recommend getting much above 2,000 or 3,000 IUs a day, because those higher doses have not been well studied long term for safety.
I think this. What you say about the multivitamins is very interesting, because it's very common for people to take those, and then there's all this supplementation in foods and so on that are available to people. So it's interesting that you're seeing that this could be very important, actually, that this could be beneficial. I will follow up on that one, because I think the vitamin craze here in the United States is quite something. And also, it's very important to try to understand it. Dr. Manson, I really appreciate your giving us this information, especially about the types of testing and the overall results. Thank you very much for this today.
Thank you so much, Yvonne. It was great to be here.
Thank you. Bye-bye.